So the National Health Insurance, as we have it, it has been founded through taxes and the items that you and I buy in the markets, which indirectly we pay taxes on them, or 2.5%. So the National Health Insurance is actually financed through the Central National Health Insurance Fund, which is sourced from the National Insurance Levy of 2.5% tax on selected goods and services. So there are things that you and I buy in the market. Immediately you buy those things, you are paying 2.5% of that money into the National Health Insurance Levy. And government take all of those monies into the National Health Insurance account. And 2.5% of the Social Security and National Insurance Trust from all the Senate contributors, and the payment of premiums and donor funds. So these are the areas that National Health Insurance actually gets money from to be able to make payments and provide healthcare services to our people. So the 2.5% is on selected goods and services. Sometimes you go to the restaurants, you go and eat, and when you are paying 2.5% of the money that you are paying there is going to the National Health Insurance.
I'm going anywhere against it.
You go and buy things in the market, and 2.5% is on that. It's going to the National Health Insurance. When those of you are building houses and all that, you are buying building materials, 2.5% is going to National Health Insurance. You buy rice and some other stuff in the market, 2.5 go to National Health Insurance. And those of you who are contributing National Health Senate contribution, that is Social Security and National Insurance Trust Senate, then you're also contributing 2.5% of that contribution to the National Health Insurance. The payment of premium, that is the money that people pay to benefit from the insurance. That is those who are informal sector. They pay maybe 270 or 250 Ghana cedis to benefit. And then we also have some donor funds coming on board to support the National Health Insurance. From the philanthropists such as Gilbert and the wife, we also have some donor individuals coming on board to support. Individuals who are also enrolled in the formal sector also contributing it are exempted from the premium payment. So you and I know that those of you who are paying Senate contribution, you are exempted from the premium payment. As at 2012, over 70% of the National Health Insurance financial inflows normally come from the National Health Insurance National Health Insurance Fund levy. Most of them are coming from the National Health Insurance levy, because that is what the 2.5% on all the selected goods. So about 70% of the fund that go to National Health Insurance is coming from that levy, because there are a lot of things in the market. When you buy, 2.5% directly go to the account. Whether you like it or not, you eat. Whether you like it or not, you buy clothing in the market. Whether you like it or not, you buy fuel. Whether you like it or not, you are going to build, so you buy building materials. Whether you like it or not, you are going to buy so many. You go to recreational centers, go and spend weekends, hotels and all that. And you also pay the bills that you pay there, 2.5 goes to that account. So we are not surprised that 70% of the funds come from that amount of that taxes. Then 17.4% from the Senate contribution. That tells you that not majority of people in Senate, or in other words, majority of Ghanaians are not in the formal sector. If you look at the formal sector, recently it's employed about 700,000 people. Not even up to 1 million of the Ghanaian population are employed at the formal sector. So that tells you that majority of the people are in the informal sector. Currently, if you take the informal sector, I'm not even sure, even though there have been some employment recently, I'm not sure we are even up to 900,000 out of the 31 million that we have. So it's only few people that are found in the formal sector. Majority are in the informal sector. So we are not surprised that only 17.4% are the funds that are coming from SNIT into the National Health Insurance Fund. For the premium, it's only 4.5%. So those who are in the informal sector and they pay premium, it's only 4.5% that goes into the National Health Insurance from the premium payment. That also tell you, or that is also an indication that majority of Ghanaians are not on the National Health Insurance. Because if they are, then the premium payment should also increase. However, in other words, if you want to look at that, you want to juxtapose that with the numbers. How much is the premium they pay? That's another area that you can look at. If you are paying 250 or 25 Ghana cedis or 27 Ghana cedis as a premium, you can imagine, even when 1 million people pay that, they only give you about 2.7 million cedis. That's what you can get. So that is why the percentage contribution from Senate contribution is also low, because of what the premium that is being paid. Please, if you have any question, I'm ready to respond to it before I continue. If you have any question, please.
Yes, I have a question.
Please, I can't hear you. I can't hear you. If you can come clearly, your line is bad.
My network is very bad.
Yes.
Oh yeah, oh sure do you. School for.
Or can we continue? If there are no questions, can we continue?
Let's continue.
Okay. Other sources of funding to the National Health Insurance Levy or fund include money allocated by Parliament of Ghana. So Parliament of Ghana also, through the budgets of Government of Ghana, also allocates some monies to the National Health Insurance. Then we also have grants from international organizations, from telcos and all that. We have donations, we have gifts, we have voluntary contributions, and also interest accrued from investment. You know, the National Health Insurance, the money in accounts, sometimes they also invest the money. They used to buy treasury bills and all that so that they can generate some interest on the money. So that also come a long way to help support the National Health Insurance. So there are voluntary contributions, donations, gifts, and also interest that accrue on the fund that you already have in the account. So this is what also come on board to support the National Health Insurance. Overall, more than 60% of active members of the National Health Insurance are under the premium exemption category. That is another big challenge confronting the National Health Insurance in Ghana. If you take about 60% of active members, they are under exemption of payment of what? Premium. That is people who are older than how many years? Is it 70 years? Children below 18 years? All these people are under exemption. So who is going to pay for them to benefit? That's another challenge confronting the National Health Insurance in Ghana. Why you have about 60% of active members are not paying premium because they are 70 years above they are below 18 years. Who is going to pay so that they benefit? That's why in some quarters, people describe our national health insurance as is too generous. As a result, it will not be able to sustain its activities because about 60% are not paying, and who pay as they enjoy. We also have pregnant women who are also added onto the national health insurance as far as you can confirm that you are pregnant. Yes, ask your question.
Sir, I would like to know, but say they don't pay the 60% that you are saying. They don't pay, but at least they go to market and all those things to get foodstuffs. That is the 70 plus at least. They go and they move about. So in a way, they pay something.
You and now you are also going around the market buying, but you still pay.
Yes.
Yes.
But I'm talking in terms of the 70 plus only, and they are under 18 years old.
Yes.
They don't pay the premium.
Yes, they don't pay, except the things that they buy in the market and pay those 2.5%, which everybody else is also paying.
Okay. So we are saying that with them it's only the premium.
Yeah. They don't pay the premium.
Okay.
Yeah.
But sir, you can bear with me that even with that thing alone self, it can generate a lot of money. Because our buying and selling those stuffs, that 2.5 from that buying is, and that thing, if you look at it, is almost every day. So that amount is even more substantial to I think equip them not to even add the one coming from Parliament and the Senate. If to my view, that's what I think.
Yeah. What you are saying, yes, in one way or the other, but what we are also saying is that they all contribute. We all go to the market and buy. We all go and pay this money. But why is it that there are people who also go every day buy, but they are not enjoying it? Because they have not paid the premium.
Yes, the premium.
Yes, it's what you pay to make you entitled. Here, like the case, they are not paying, and yet they are benefiting. So that's the challenge we are talking about. As of buying in the market, we are all buying in the market. And that has also contributed to the 70% that we have actually identified, coming from the taxes that we pay. However, about 60% who are enjoying this, they are not paying anything at all. And that is so worrying. So that's what we are actually referring to.
Yes, sir. Thank you, sir.
So as I was saying, the critics of the Ghana National Health Insurance, they agree that the scheme is overly generous and financially unsustainable because of what the huge percentage of the members under premium exemption without co-payments. They are not paying premium, and they are also not paying what we call the co-payment. What is co-payment? If I may ask, what is co-payment in insurance or in healthcare delivery? I talk about this when we are looking at the framework. What is co-payment? It is also there on the screen. What is co-payment? It's simply where the subscriber share the cost of healthcare with the insurance provider. There are some healthcare conditions that you all know that the national health insurance will not be able to take care of it. So you as an individual who is also benefiting, you pay part, and then the national health insurance also take over. For example, when you look at cancer issues, it will be very difficult for national health insurance to foot the bill of cancer patients, simply because it's an expensive venture. So when you have a shared responsibility where there are some individuals can actually come with what we call co-payment. They can pay part of their fees so that the insurance take part. You can maybe TB treatment or diabetes treatment. They pay half and the insurance also pay half. That's what we refer to as co-payments. Because we are overly generous, 60% they are not paying the premium and yet they are enjoying. And they are not even doing co-payments. As we say, that can also be a challenge confronting the national health insurance. So coupled with increasing cost of medical logistics, supplies, and health service delivery. You know, cost of medical care is increasing day in, day out. Drugs are expensive these days. Machines for diagnosis and all that are expensive. Look at how much is spent on one person when you are infected with COVID. Somebody who stayed in intensive care unit, by the time they were discharged, they are supposed to pay like 80,000 Ghana cedis. So all of these are huge fines. And when do we get money to pay all of this? So all of these things contribute to a huge debt that the national health insurance have to deal with. Not only that, the national health insurance itself, mismanagement is also there. We have seen where areas national health insurance funds are used to pay student allowance, nursing student allowance. And that is what probably is not expected, but we have seen it happening. We also have to do is management. However, we want to look at some of the diseases that are covered by the national health insurance. And we all know that national health insurance does not treat every diseases or all diseases suffered by the insured members. However, many common diseases such as malaria, upper respiratory tract infections, diarrhea diseases are covered in the national health insurance benefit list. Likewise, the national health insurance members are entitled to medical emergency care, such as road accidents, also under free national health insurance for pregnant women policy, which was introduced in July 2008. Now pregnant women are also exempted from premium payment so that they can have access to antenatal care, ANC services. Diseases such as cancer, which are relatively not common, are not covered by national health insurance. But as you speak today, cancers are becoming so common. So we can't say today that cancer or cancers are no longer common. They are common. We can testify to that. Breast cancer is increasing. Prostate cancer is increasing. Cervical cancer is increasing. Childhood cancers are there. Leukemia and others. So all of these are increasing day in, day out. So we must develop a strategy of putting them under the national health insurance and probably adopt what we call co-payments so that all the chunk of the money will not be used to treat cancer. They can also cater for other conditions. The objectives of the scheme is one, opportunity is provided for all Ghanaian citizens to have access to functional structure of the scheme. That's have access to national health insurance. That at the end of the day, when you are sick, the basic health services are provided for you. Citizens do not move from an affordable regime to another unaffordable health insurance policy. You remember cash and carry system. We do not want people of this country to move from one cash and carry system that is already unaffordable to another. So as a result, we have introduced the national health insurance. A sustainable insurance option is made available to all Ghanaian citizens so that we should all be able to access the insurance all the time so that we can benefit, and also to improve the quality of healthcare provision in the country. So these are some of the objectives why. There are other objectives actually, but these are some of them that I have listed here. That are the reason why the insurance scheme was introduced. And we can also look at some of the diseases covered. I've already mentioned them. Malaria, diarrhea diseases are there. Upper respiratory tract diseases, skin diseases are also there. And then we also have lifestyle diseases, that is hypertension, diabetes. The two are there. We have asthma, antenatal, prenatal, and postnatal services. So these are some of the diseases covered by the National Health Insurance. Then we can also look at the services provided by National Health Insurance. Outpatient care services, emergency services that are provided, maternal and newborn services that are provided, behavioral health treatment as well. So some behavioral treatments are coming forward, health education and all that. There are challenges that we can look at. So these are the areas that are covered by the National Health Insurance. Then physical and occupational therapy. These are some of the services provided by the National Health Insurance. Laboratory services. However, there are some of the laboratory requirements that you are made to pay for. There are some that are covered under the National Health Insurance. We have preventive services. Immunization, vaccination are also covered under the National Health Insurance. They are also covered by the National Health Insurance. Pediatric services, we know our children also benefit from the National Health Insurance. Then we also have an exclusive list. That is areas that are not covered, conditions that are not covered by the National Health Insurance. Certain diseases were, however, excluded from the benefit package because it was considered to be too expensive to be treated. And we can identify some of this. Optical aids are there. That is hearing aids second. We have orthopedic aid, beautification surgeries or plastic surgeries, treatment of renal failure. However, supply of HIV drugs have been subsidized by government of Ghana. And I think they are covered now. So we can take that out of the list. The supply of National Health Insurance drugs, they are covered. So we can take that out of the list now. Then heart and brain surgeries. These are not easy to be done, so they have been excluded from the benefit package so that others, because they are expensive, the scheme will not be able to provide the services. So based on that, they will be able to save a lot of money to provide services that others need. Because if you look at heart and brain surgeries, the cost that is involved is so expensive, and the health insurance will not be able to provide the costs. Then we can also look at some of the challenges and controversies confronting the national health insurance. Political influence. I told you hitherto, the appointment of people into this management position are influenced by politics, the party they belong, and how much they contribute to the party to come into power. So the political influence, who is the general manager and all that, and that affects the operation of the national health insurance. Failure implementing the introduction of one-time premium. You remember the late president talk about one-time premium, but that has never been what? Materialized. So that is also a huge challenge to the national health insurance. Poor payment of claims. There are a lot of people, not people per se, the health institutions that we have in this country. A lot of them, their claims have not been paid. So how do they continue to provide services? It's a challenge. And some of them too are corrupt. People have not come to the hospital, but they use their card and process claimant form to go for the money. Especially the private ones. They organize health screening and all that. Bring your national health insurance. When you come, they take your numbers. When you go back to their health facility, they fill the form that you have come for service, or government should pay for service. Meanwhile, you have not been there. You see how we are corrupt in this country. Also, delay issuing cards, but that has been taken away. That's been catered for because there's online renewal now. So unlike those days that people spend, you have to sleep there or form a queue using stones so that the following day you can have access. That has also reduced as a result of online renewal and registration that we have in place. Inability of majority of Ghanaians to pay the premium. We've already established that about 60% of the population are under exemption. Therefore, they don't pay the premium. And that is a challenge to the sustainability of the national health insurance. The high level of out-of-pocket payments, which impoverish the poor patients and limit access to quality health care, also accounted for 32% in 2016. What we are also saying is that even though we have the national health insurance in place, we still have out-of-pocket payment. That a lot of people are paying money at every point of service delivery within the hospital. And this is confirmed recently by Joy News investigation, when they have realized that they found some hospital, people are still paying for services that are covered by the national health insurance. So it's also a challenge. Then if you look at the ratio of professionals to the population, in Ghana, we also have a huge challenge. We have a lot of people that are being trained now, they are in the homes or they are in the house, and they are home, they are not being employed. But if you look at our population ratio in terms of health professionals we have in this country, it's not the best at all. About 15 physicians and 93 nurses to every 100,000 population. That is 2010. But as we speak, that has also actually improved. We have about 25 now physicians up to 100,000 population. So that has also improved recently. If you take about 100,000 population, you have about 25 doctors to them. If you take about 100,000 population, now you have about 120, 130 nurses to them. And 97.5% of Ghanaians, we can also say that they have access to primary health care because of the concept that we have implemented, the cheap compounds that we have implemented. Because it's everywhere you go, you see the cheap compound, and that has also influenced the access to national health insurance. So that is also a challenge to us. But because of the chiefs zone and compound that we have, it has make the health providers closer to the communities now. So the Ghanaian healthcare system has been also described as the most successful healthcare system in the Africa continent by the renowned business magnate Bill Gates. That if he has gone to Africa and looked at most of their health insurance systems and has identified the health insurance in Ghana as one of the best that he has seen. And that is telling us that if we are seeing, or we are saying that the Ghana health insurance, that we all know the challenges that we have, is the best in Africa, then we have a long way to go when it comes to African continent. Because we have a lot of challenges. Claimants have not been paid. People are still paying for services that are supposed to be covered by the National Health Insurance. However, in all of this, we are still being described as the best in Africa. Then the continent have a long way to go. And Ghana has a universal health care system. That is the National Health Insurance for everybody. So this is why we'll end our lecture today. So I want to respond to the question that we have before the system close us. Thank you.
Thank you, sir.
Thank you, sir.
You're welcome, dear.
So my question,
Okay.
I want to ask if dental services are included in the NHIS.
You want to ask dental services?
Dental services.
No, I'm not sure of that. But recently, I am told that it's also covered. And yet people are still charging for it. But it's something that I have to find out and confirm. Because that also appeared in the report that came on recently. That the dental services are covered under the National Health Insurance. And yet the facility are still charging people for it. So it's something that you and I have to go and find out whether that is true before people are still charging for it. Is that okay?
Okay, good. Thank you.
Okay, you're welcome. Any other? We still have 3 minutes to go. So if you have any question, please ask so that we can respond to them. Any question? If you have any question, I'll respond to them. And then we close. But in absence of any further question, then we can close.
Yes, sir.
Okay.
Say good night.
Good night.
Good night, sir.
Yeah.
Thank you.
All right. See you tomorrow.
Yes, sir. Thank you, sir.
Yeah. Bye-bye.
Bye.